So it's good morning, America. Good afternoon, Scotland. It's my pleasure to welcome you to this event on international action on school meals in times of crisis. My name is John McKendrick and I'm from the Caledonian University in Glasgow. That's Glasgow, Scotland, not one of the 21 Glasgows that can be found across the USA, because of course our two nations have much in common and the bonds between them are strong. Now, naturally, there's been a few difficulties along the way. Minor disagreement about taxation and representation back in the 18th century, leading to the dumping of perfectly good tea in a Boston harbour, springs to mind. But by and large, our links have been positive over the years. You'll know from America, of course, Senate Resolution 155 declares that April 6th is Tartan Day, where we recognise the role of Scottish Americans in the founding of the nation. And many key figures in US history of Scottish DNA, some of your more revered presidents, no, not that one, I'm talking about Jefferson, Wilson and Roosevelt, can trace their heritage back to Scotland. John Paul Jones, the founder of the Navy, Andrew Carnegie, industrialist and great benefactor, John Muir, founder of national parks. All of these great historical figures in history in America can trace their heritage back either directly or indirectly to Scotland. And of course, we in Scotland are looking forward in the post-COVID times to welcoming back the 500,000 visitors that we receive every year from the USA. Now, as well as these links, and historically, we also have the fellowships of the Winston Churchill Memorial Trust. And that gives 150 individuals in the UK the opportunity to travel the world and to meet global leaders and to advance their understanding of issues of interest to them and of interest to the UK. And back in 2014, Lindsay Graham, the Scottish version, not the senator, spent some time in the USA. She met Katie Wilson, who accompanied her on a tour of a presidential scale, visiting 9 states over the course of 37 days, learning about the logistics of summer school food provision. And on her return, Lindsay has been instrumental in campaigning for dignified and effective solutions to tackling child food insecurity ever since. And it was those connections forged in the UK 7 years ago that are at the root of what brings us together this afternoon when we look at the specific issue of school meals provision in these unusual times. And what a week to be having the event. It of course is the eve of International School Meals Day, hashtag ISMD 2021. Here in Scotland, the Scottish Government announced that they would be intending to extend universal provision of school meals, free school meals, to all primary school pupils by August 2022. And in the USA, your Department of Agriculture announced the extension of free school meals into the holiday period through until the end of September. So what about this event then? Well, it's a platform for us to share and to develop an open forum for collaboration, a chance to consolidate past work, but also to act as a catalyst for future work. So what have we got on offer? Well, we've got 8 presentations from some of the leading figures in school meals work, 4 from US and 4 from Scotland. And towards the end of the day, we'll have a panel discussion, which is based on questions that have been pre-submitted by you, the delegates. But we have I'll introduce the speakers before they share their thoughts, but for sense of overview, there'll be 3 paired presentations, 1 from Scotland, 1 from the USA. First of all, looking at programme design and focus, then moving on to look at operational issues, and finally to look at research. And we'll close off the day with a pre-recorded message from our Deputy First Minister and Cabinet Secretary for Education and Skills in Scotland. But before we start, before we get into the meat of things, just some housekeeping measures to make sure that we get the most of the event. Now, we're using the Zoom webinar platform today, so there's no need for you to worry about being on camera. For those of you that have combed your hair or ironed your blouses or shirts, you've wasted your time and no good reason to do so. Today's talk will be available afterwards, so if the connection drops from time to time, there's no need to worry. You can access that after the event and you're more than welcome and encouraged to share that. But in terms of us during the event, how we can get the most out of it, we've got 2 functions that you might want to use. We've got a chat function, which is for general comments, feedback and thoughts, not for posing questions, just a general discussion that you might want to have or comments you may want to make and what the speakers say. But we do have a separate Q&A button, and you can see that at the bottom of your screen, just along from the chat function. And that's where you can add your questions if you want us to answer something in the discussion session. Now, we might not be able to do so. As I say, we've already picked up a number of questions that have been pre-submitted. But if there's a burning issue, we'll try and cover it. And if we're not able to do so, we'll certainly pick it up in what we hope will be a series of events that follow this first one. Now, unlike in-person events, I don't need to tell you where the bathroom is, and I don't need to tell you what to do in the event of a fire. So let me move on to introducing our first speaker. And it's an honour and a pleasure for me to introduce to you Cindy Long. Cindy is Deputy Administrator of Child Nutrition Programmes in the Food Nutrition Service of the United States Department of Agriculture, the USDA. She's responsible for these programmes that include school breakfast food and school lunches, delivering over $20 billion worth of nutrition assistance to families. Without further ado, ladies and gentlemen, Cindy Long.
Hello, good afternoon, everyone. It's a pleasure to be here. As you just heard, my name is Cindy Long, and I'm, as you can tell by my title, I work for the Department of Agriculture, where our school meal programs reside in the U.S. I thought I could take just a few moments this morning to kick things off by giving you a bit of a high-level introduction to the school meals program in the U.S., and then spend a few minutes talking specifically about how we use these programs as a response to COVID-19. And I know you're going to be hearing more about that in depth from some folks later on. So my agency, the Food Nutrition Service of the Department of Agriculture, is responsible for running 15 distinct nutrition assistance programs, which prior to COVID provided about $100 billion a year in nutrition assistance, with a particular focus on children in low-income families. One thing that's important to recognize is that these are national programs, but they actually have a decentralized structure. The programs are authorized in law by Congress, and USDA at the national level provides the funding and sets out the requirements broadly for the programs consistent with the law, but they're actually run and administered on a day-to-day basis by our states. And then of course they are executed at the local level by schools. So that's all important background for understanding our COVID response. When the pandemic hit about a year ago, almost exactly a year ago, virtually all schools in the United States closed down by mid-March, which posed massive challenges as we considered how to ensure that kids continue to get access to the food they depended on. Many students, low-income students, particularly in the US, receive both a breakfast and lunch every day at school. So the potential loss here was huge. And of particular concern, in addition, given the economic devastation that was associated with the onset of the pandemic. Our school meals programs by law and structure are very much designed to operate in a world where kids are in school, sitting in chairs in a cafeteria. So we had to move very quickly to restructure. Thankfully, our Congress acted very early in the pandemic to provide USDA the flexibility to do just that, to modify the structure of the programs to address pandemic circumstances and to provide additional funding. And both of those were critical to the response. With this flexibility, we were able to, number one, allow for what we call non-congregate feeding. Again, our regular structure is premised on the assumption that meals have to be provided at school during standard meal times, et cetera. Very much a model of kids sitting in chairs and eating a meal. With this flexibility that we were provided, we were able to waive all of these types of rules in order to recognize that schools were closed and allow program operators to operate pickup sites where parents could pick up meals for a day or for multiple days. In some places, delivery models were set up where meals were dropped off at home or at multiple pickup points, such as the school bus stops. The second flexibility had to do with what we call area eligibility. I mentioned earlier that our programs have a significant targeting component, meaning that low-income families receive meals for free and schools receive the highest levels of reimbursement for those meals that are provided for free. Other families pay for part of the cost of their meals, and the government reimbursement to schools for those meals is significantly less. They receive some funding, but much less. With COVID, we provided the ability for all areas of the country to be considered at highest need. And what that meant was and is that all children can receive their meals for free, and the program operators receive that highest level of funding from the federal government that is associated with those free meals. So this allowed us to both ensure that we were reaching kids in need during this period of rapidly increasing economic hardship, as well as relieve schools from the burden of looking at who's eligible and providing them with the highest per meal rate, as well as providing schools with the highest reimbursement available. The final piece for school meals is our nutrition standards. We have put a great deal of time and effort, and we're very proud of these efforts in recent years to improve the nutritional quality of school meals. However, we recognize that what you can prepare and serve in a cafeteria can differ quite a bit from what you can pack for someone to take home in a bag or a box in a pickup model. For example, we typically in the regular environment require a specific variety of vegetables to be served over the course of the week. And that could be much more challenging in the non-congregate environment. There were also some supply chain disruption concerns early in the pandemic in some locations that limited the availability of certain foods. And the need for school nutrition workers to stay socially distant also creates challenges for meal preparation. So for all these reasons, we provided broad flexibility for providers to serve the best meals that they could under the circumstances, but did not enforce the very specific nutrition standards that were in place. So these flexibilities allowed our heroic nutrition program workers at US schools to use their creativity and serve meals in their community in a variety of ways to meet the local need. I know you're going to be talking more about the specifics, but I'm not exaggerating when I use the word heroes. One of the things that COVID showed us was how many families depend on these meals and how our providers rose to the challenge to keep those meals flowing and to make them available. I don't even want to think about what the impact on some of these families would have been if that didn't happen. We can move to the next slide. And finally, before I close, I did want to mention that another part of our response, in addition to really restructuring the existing, temporarily the existing school meals programs, I wanted to mention that there was a new program created as well. It's called Pandemic EBT, and its basic structure was to say that for when schools were closed, for all of those children that received either those free meals, those low-income children, they would receive their families would receive an EBT card with a dollar amount that their families could use to buy for food that was meant as another backstop so that they would ensure that they have the resources to feed the children when school meals were not available. So it was an additional response to meet that need. It was very challenging. It's always challenging to stand up a totally new program out of nothing. It required close cooperation of our education operators, our schools, and the agencies that run our SNAP program. And many of you may know the SNAP program used to be called food stamps, is our fundamental nutrition assistance program in the US. And it provides, families with cards for food using an EBT platform. But it was, in the end, we were successful in standing up this program in every state, and it provided over $10 billion in additional nutrition assistance last spring. Congress did extend and modify the program for this year to address not only circumstances when schools were completely closed, as was the case last spring, but also situations where some schools are closed, some are operating at reduced hours, some are operating at reduced attendance schedules, which can also cause kids to miss meals. So the program was extended and revised to adjust changing circumstances. It continues today, and it continues to be part of the support that is occurring in the US to address school disruption and the associated loss of meals. So with that high-level introduction, I'm going to turn it back over. Thank you very much for the opportunity to be here.
I think we're just going to bring Claire in now, if you'd like to, Claire and Dr. Katie Wilson, sorry, Claire Hislop, I should have said, if you want to start your presentations. Thank you.
Okay. Thanks for inviting me along to speak today. It's been such a privilege to be involved in the development and implementation of the work carried out across Scotland to improve not only the nutritional content of school food, but how our children learn about food and to give them the skills to make informed choices that will last throughout their lives. This policy sits within a much wider work that we are undertaking across Scotland to improve the food environment and make the healthier choice the easier choice, and schools have a critical role to play in supporting this work. Today, in the short time I have, I hope to give you a whistle-stop tour of our journey to improve school food. This has been a journey that started 18 years ago with the publication of the Hungry for Success report in 2003. This was a flagship policy, as this was the first ever to include a requirement to nutritionally analyse school lunch menus to meet minimum standards. It also set out standards to ensure that what we describe in Scotland as a whole school approach to food in schools, and was backed by significant financial investment from the Scottish Government. It set out recommendations which were designed to revolutionise school lunches and also improve the health and wellbeing of Scotland's children and young people. And it was based around 7 key principles which are outlined on the slide. Uniquely, the policy also set out clear lines for monitoring of its success in schools. And this was done through our national school inspection process. And I was very privileged to be the first health and nutrition inspector appointed within Scotland's national school monitoring organisation, Education Scotland. This monitoring is shown to be influential in both ensuring standards were upheld, but have been really important in identifying areas for improvement. The learning that was gained from this was also invaluable and allowed us to share learning across the country and work with local authorities to help develop and change their school food offerings. Over the next few years, local authorities worked really hard to make the changes required, and we saw a vast array of changes, not only to the food options, making them more healthier, but also to enhance the environment in which children and young people consumed this. So this included things like more appealing and unique dining spaces, better queuing system, and procedures to respect the anonymity of children on free school meals as well. However, there was still one thing that was identified as a gap, and this was a link to the rest of the school day and what was happening within the curriculum. Can I have the next slide, please? So in 2007, building on the significant achievement of Hungry for Success, the Schools Health Promotion and Nutrition Act was unanimously approved in the Scottish Parliament. And this Act, which is similar in ethos to the USA's Healthy Hunger-Free Kids Act of 2010, made health promotion a central purpose of schooling. And this legislation put emphasis on the roles that schools had to play, both in improving children's health and children's diets. And this Act set out duties which were critical in taking Hungry for Success to the next level. The regulations followed in 2008 and aligned the nutritional standards for all food and drink along with our Scottish dietary goals for the population. And these regulations were different to Hungry for Success, which had only previously looked at school lunches, but this also included set standards for all food and drinks across the school day, so included things like breakfast clubs and tuck shops. Next slide, please. So to implement these standards took a huge effort by all. Some of the key areas which supported the success of the development and implementation included, firstly, effective partnerships. And these were wide and varied, from specialist nutritionist support, local authority catering and education staff, manufacturers and suppliers, and also the third sector to ensure that we worked collectively to maximise the impact of these standards. Secondly, consultation. This was a key part of both the work in preparation of the standards, but throughout the implementation. And this needed to happen both at a local and a national level. So, for example, we worked with the food industry to ensure that we had products available to meet the standards. We worked with local authorities to ensure the standards were realistic and reflected differences in things such as rurality or local demographics. And most importantly, we undertook extensive consultation with those with whom the regulations would most impact upon. So, for example, school and catering staff, and the parents and children and young people itself, as it was really important that the standards were accepted to them to ensure that we had take up and reduce waste. And lastly, communication. This was absolutely crucial throughout to ensure that everyone was clear on why the changes were being made and what to expect. So this communication was far-reaching and included extensive training for staff and communications to both parents and children and young people. Our standards in Scotland have been around for a number of years now, and it's really important that we constantly reflect and review that these are still appropriate. Issues such as staff turnover, changes to trends in popular foods, and changes to the scientific evidence base on which these standards are based must all be reviewed regularly to ensure that these have most impact. Over the past few years to support this, we continue to monitor the standards through the inspection process. We encourage self-evaluation by local authorities to check that the standards are being maintained, and we have published refreshed guidance to keep the importance of these standards at the forefront of people's mind. Our most recent update to the regulation, initiated 10 years after the publication of the Act, was to reflect both changes to the scientific evidence base, but also to use the information from inspections to reflect the trends that had been observed in how children and young people choose food and drinks whilst in schools. And these changes are due to be implemented in schools in April this year and are an important step in keeping this relevant. The success of these regulations has been a result of a lot of hard work. It hasn't always been easy. Implementation was much harder in our secondary schools for our young people compared to our younger children in primary schools. And it's really been important to take all those involved along with us each step of the journey. And it did take us a while to ensure that everyone understood that they were in this for a long-term goal. But over the years, with the commitment from such a wide range of stakeholders and the children and young people themselves, the work we've undertaken to improve school food will undoubtedly play an important role in the challenge we face in Scotland to improve diets of our population. Thank you, and now I'll hand you over to Katie.
Thank you, and I'm so glad to be here as well. And I think as the participants can see that safety nets are definitely both in Scotland and the US are certainly involve school meals. So I'm going to talk very quickly a little bit about the history of the school nutrition program in the US as to why we have it and why it became a national program. And then I will touch base about the Healthy Hunger Free Kids Act, which was our huge redo of school meals and the nutritional quality. But really, the United States Department of Agriculture, as Cindy clearly talked about, is where we house all of our nutrition programs in the United States. It was established in the 1800s by President Lincoln, and it was really a program about land cultivation, conservation, economic development, and it was to help the small farmers be more progressive and also to be able to provide for themselves and their communities. And then it began to connect the farming community and the great agricultural resources we have in the United States to nutrition and feeding the population of the United States. Because we know now more than ever, these kinds of things are important. They were important in the 1800s, and we see now that they're still very important to connect that agricultural resource to feeding our populations. Truly, we believe that food is a right for human dignity. Next slide, please. In the 1930s then became the Great Depression. We were right in the middle of the Great Depression, and people began to realize that children were coming to school and they were malnourished, they were tired, they were ill, they had a lot of nutritionally based diseases. And so there was a program that began to think about feeding children in their schools. This really started with mothers in the community bringing food or teachers in a one-room schoolhouse cooking food at the schoolhouse, and then the farmers bringing extra food into the schoolhouse for those children. But the USDA at this time began to look at what was on the agriculture marketplace. Because of the Great Depression, there was a lot of extra food and resources that were there that farmers had produced, and there was nowhere to sell them. And so the United States Department of Agriculture decided to purchase these foods off of the marketplace, helping the American farmer, and then give those foods to the school systems to feed to our children. This is how we got what we call the USDA Foods Program. Some people know it as the commodity program. About 20% of the budget from a national school lunch program in our school systems is now still part of this program. So we get about 20% of our budget is food donated by the federal government that we get to use in our programs. And this also put many women to work. That's what WPA is. They wanted to make sure people were going back to work after the Great Depression. And in particular, women came into schools to begin to cook meals. So this was really the beginning of all of this National School Lunch Program. Next slide, please. So then we come into the 1940s, and it was President Truman sitting there. And we said it was called the Do Nothing Congress, but those of us that are in school nutrition believe it was one of the best Congresses, because that in 1946 is Harry Truman signing the National School Lunch Act. And this was really because of national security before it really became part of the nutrition world. And what was happening is that young men coming to the draft for World War II were malnourished. They were coming out of the Depression. There wasn't enough food. People had been starving, not eating the right kinds of food. And so they were not able to join the draft to fight in World War II because of the lack of nutritional quality in their diet. And so they began to think about, how do we do this? How do we begin to change this in the United States? And this was an issue of national security. And so in 1946, they signed the National School Lunch Act, which gave the school districts the ability to have this program where they were being reimbursed for feeding children in school. And they did that in school because, number one, many children came to school. And number two, they also thought that having food in school would bring children to school. And both of those things became true. And here we are again in 2021, and we have a team of retired generals called Mission Readiness, and they are once again looking at school meals as a measure of national security, because young men and women are coming into the military with issues of obesity and diet-related diseases. And so they're once again looking at school meals as the preventative measure for national security. Next slide, please. So some of the basics of school meals. Like Cindy said, we have breakfast, we have lunch, we also have school snacks, after school snacks, and we have after school supper for some of the most needy children in our communities. So it's really a comprehensive, that's why I call it the safety net of all safety nets. It's comprehensive. It gives children the ability to truly get a good wide-based diet. And of course, the nutrition standards are based on the most recent dietary guidelines for Americans. Just like Scotland, we have to keep revising ours, keep re-looking at it. How do we make sure that the school meals reflect the dietary guidelines for Americans? Dietary guidelines for Americans is revised every 5 years by a team of nutrition and medical scientists, so that we know that it's the latest science in nutrition. The reimbursements from the federal government are on a per meal, per day basis. And so that's where some of our work gets a little more complicated. Children qualify for free meals, a reduced priced meal, or a full paid meal based on family income. And every single day, our school districts have to identify each individual child and what category they're in. And that is how they claim their reimbursement at the end of the month to get their money back from the federal government. Reimbursement is based on family income. These are some of the issues that we are challenged with because many times that issue falls on the shoulders of the children in the school. And some of you have heard of some of the issues we've had called lunch shaming, where if you don't have money in your account and you don't qualify for free meals, some schools have local policy that say the child doesn't get to get that meal. They either get a different meal or they call their families, whatever happens there. But what happens is that the issue of reimbursement, family income, lands on the shoulders of children. And we're really working hard to change that right now. Reimbursements for qualifying meals only, they must meet the minimum food components to claim that reimbursement. Like Cindy said earlier, we have a waiver now that doesn't require us to do that because of the pandemic. But in normal settings, there's the strict nutrition standards, and we are audited every 3 years. And if they don't meet those if they don't meet those nutrition standards, then they may not claim that meal for reimbursement. So sometimes it's a situation where you force a child to put food on a tray, which also we're trying to get through some of those challenges. Next slide, please. So the Healthy, Hungry, Free Kids Act of 2010, that was the most sweeping changes to school nutrition in 30 years. The First Lady, Michelle Obama, worked very hard on that. There were lots of stakeholders that were engaged in that. It was every 5 years, school nutrition programs in the United States get reauthorized. And so once again, with reauthorization every 5 years comes new rules and regulations, hopefully based on those new dietary guidelines for Americans, new nutrition science. And so this was sweeping change, just like Scotland had. We did it in 2010, a lot of pushback, a lot of challenges, but we've worked through it. And we've really come to know 10 years later that those changes were working, they're working. Us too, it's very difficult to get the older secondary students to participate, but the primary students now are the secondary students from when this happened. And so we have really moved on, and we have a lot of statistics that show that this really worked, and it increased the nutritional quality of the meals that children were consuming. And we also know that student participation rates really became quite high. And part of this was our great farm to school program, where we really connect with farmers. Once again, going back to what this started from in the 1800s, and the farmers now can be directly related to the procurement of foods for schools. And so that brings in a lot of local procurement as well, increasing the fresh fruits and vegetables that are involved in these programs. So a lot of technical assistance needed, a lot of research needed, but we know this is what works for kids, and it's our responsibility to make sure that we carry on. Thank you, appreciate the time.
Thank you very much, Katie. Well, when you get the opportunity to listen to somebody who's Executive Director of the Urban School Food Alliance and was appointed by Professor Obama as Deputy Under Secretary of State for Food, Nutrition and Consumer Services. And when you get the chance to listen to somebody who's organisational lead for nutrition, diet and physical activity in Public Health Scotland, then you're going to learn a lot and understand the broad context within which we're operating. And together, I think Cindy, Katie and Claire have given a really good introduction and setting the scene in terms of the organisational focus of the school meal service. Long-standing issue, but with renewed energy in the last 10 years. Cindy certainly demonstrates the flexibility and responsiveness that's been shown in the last 12 months as we've risen to the challenge of the COVID situation. I think Katie picking up there on the wider purpose of school meals, it's not just about food, it's about what our nations want to be, what our nations hope to achieve. Very much clear in that history of where school meals are at. And at the current time too, we don't just provide meals because we want to provide food, we want to provide opportunity and allow children to realise their potential. So we continue to be innovative, continue to have lots to learn. Pandemic EBT sounds very interesting over here in Scotland, and the idea of after school snacks and suppers being a larger feature in the meal provision gives us lots to think about. So a wonderful start in terms of the operational focus. And we're now going to move on to the second of our 3 sets of paired presentations to look at the operational. We've looked at the programme, we're now going to look at operational matters. Before I introduce the 2 speakers, can I just remind you, of course, feel free to make comments in the chat function. Feel free to pose any questions that you want answered to. So we'll do our very best to answer these questions if we can, but we're very keen to hear your thoughts as we move along. The chat function and the Q&A at the bottom of your screens. Now, our second presentation will be from Amy Virus. Amy is a Manager of Administration and Support Services in the School District of Philadelphia and also a board member of the Urban School Food Alliance. I love how Amy describes herself. She describes herself as working with a team of thoughtful problem solvers, which I really like that, and I have no doubt that that is the case. But before Amy speaks, we're going to hear from Jane Jones. Jane is Commercial Manager at Argyll and Bute and also Chair of Assist FM. And she's had a busy day because she's already had her spring conference for Assist FM that she was chairing earlier this afternoon. She was, and I'm going to embarrass her here, but I don't mind doing that, listed as one of the UK public sector catering's most influential people in the last 2 years. And I'm no doubt she'll be going for a hat trick in 2021. So without further ado, can I first hand you over to Jane Jones?
Thanks, John, and thanks for the football analogy there with the hat trick. I'll leave that one for you. And thanks just to Katie and Claire for outlining that wider context of school food. Claire particularly for outlining that in Scotland. It's certainly been a continuing journey for caterers across Scotland. I'm going to outline for you all how we deliver those catering services, how we have been responding to the food needs of our children and young people during the pandemic. And I'm really looking forward to hearing from Amy about her experience of providing the same responses in a much larger geographical area, as I'm sure the challenges will be similar but different, and we have a lot to learn from each other, it's fair to say. Scotland has 32 local authorities, which are similar to districts in the USA. These local authorities are responsible for delivering a wide range of local services, including things like education, social services and housing. And each of those local authorities has responsibility for delivering its own catering services to the 2,500 schools across Scotland. We're serving in the region of 350,000 meals each day. That's pre-pandemic figures, with around 156,000 pupils in Scotland who are entitled to free school meals. Now, uptake of free school meals in Scotland is around 75%. However, uptake of universal free school meals, which are available to pupils in primary 1 to 3, that's the equivalent in the USA of kindergarten and grade 1 level, that uptake is slightly higher at around 80%. Now, the local devolved delivery in Scotland means that the services provided to each and every school can be delivered in a way that best suits the needs of the communities in which that school is based, be that a large urban secondary school or a small rural or island primary school. So we are able to tailor our services and work within our local communities to best support our children and young people to access healthy, nutritious and sustainable food through their school. Because of that locality setting, our caterers are very much able to develop positive, supportive and often nurturing relationships within their schools. And what that allows us to do is to develop local priorities for food procurement, with many schools across Scotland then benefiting from locally produced and sustainable food being served in their schools. Now, if we take the Isle of Bute on the west coast of Scotland, which is too small to see on that map, we have local pupils there across the island enjoying local meat, cheese, eggs and milk from local producers. Next slide, please. During the pandemic, that local flexibility in delivery is what really helped us to be able to support our children and young people and their families very quickly. Each local authority was able to use funding provided by Scottish Government to develop specific localised response plans that best met the needs of their communities. Now, that flexibility allowed us to tailor and change our plans as the pandemic progressed, and we didn't need to remain fixed with one delivery model. As Katie said earlier, back in March last year when this all happened, and we initially probably thought lockdown might last a few weeks at most, my own local authority began by delivering hot meals to doorsteps. We were using school transport vehicles to get learning supplies, tech support, a friendly wave, and hot food delivered to doorsteps. Now, as the pandemic continued, that evolved to a whole household food and essentials delivery of local fresh food, which was developed in partnership with local businesses, and it kept some of our food and drink suppliers, as well as some of our small rural shops afloat. Then, as we emerged from lockdown, we shifted to a cash-first approach when it was safe to do so. And at present, as we are returning to schools on a phased basis, that support for our children and their families remains very important, and it remains in place. And it also remains flexible. So at the moment, most local authorities are providing direct cash payments in lieu of school meals, but some are opting for vouchers that can be spent in supermarkets, a bit like the card facility that was described in the USA, and others are delivering food parcels. And with more pupils returning to school over the coming days, we are looking forward to increasing the number of meals we're provided in our schools, with those meals being served to pupils in learning bubbles, through staggered meal times, and through in-class dining as well. So lots of different models out there. Now, despite that perhaps sounding that we have a bit of a fragmented delivery model, I think the opposite is actually true. As a small number of local authorities, we work incredibly closely and incredibly well with each other. We have a number of practical, operational and strategic ways of sharing ideas, learning and lessons. And I hope my colleagues from across Scotland who are taking part today agree that the pandemic has ensured that those relationships continue to be closer than ever. And as Claire said in her presentation, the principles underpinning our services remain intact. We've continued to work in partnership with our colleagues and our supply chain partners. They have been critical to us, not only during regular service times, but during the pandemic too. We've continued to consult with our communities and to ensure that the food support, in whatever form that takes, is meeting the needs of those who are receiving it. And we've continued to communicate as best we can with each other, with our partners, and with our families who are in need of that support. Next slide, please. As we emerge into the recovery phase of this pandemic, what caterers across Scotland also have is a clear understanding of how school food delivers for a really wide range of national priorities. And it links directly to a whole host of goals around nutrition and diet, around tackling the effects of poverty and inequality, of improving learning, of delivering sustainability and climate change actions, and driving economic growth and community wealth building. Who would have thought that putting a meal on a child's plate can deliver so much? But it really does. As Claire outlined earlier, our focus in Scotland, while still coping with the impact of the pandemic, is on implementing the changes to our food and drink standards and ensuring that what we offer our children and young people is nutritious, healthy and attractive. Now, we're only 4 weeks away from those updated regulations coming into effect. And caterers across Scotland are working to make sure that as pupils return to school, what we offer them is as nutritious and as nurturing as it can be. And I know that our frontline staff can't wait to be back to full dining rooms that are filled with bustling activity and with good food. So I'll stop there, and it's now my pleasure to hand over to Amy from Philadelphia, who can tell us more about their approach to school meals.
Thank you. It's an honor to be with you today, and thank you for the opportunity to share our story. I'm going to go to the next slide, please. So welcome to the City of Brotherly Love, at least for the next 5 minutes. Unfortunately, Philadelphia is the poorest big city in America, and knowing that our students are living in the highest rates of poverty in our country, we knew we had to spring into action when schools closed to make sure we provided meals while they were learning from home. So pre-COVID, and for the last 5 years, we have participated in the Community Eligibility Provision, or CEP, and 100% of our students are provided free breakfast, lunch, and after-school meals. Pre-COVID, we served about 130,000 meals each day in 250 schools across the city. And I'm going to give you a whistle-stop tour and walk you through some of the major milestones and decision points that helped to shape our response as the COVID-19 pandemic kept evolving. I'm going to give you a glimpse into the real world of how all of the work that many of you have put into the policies, waivers, and regulations that have helped programs like ours feed our students over the past year. So next slide. This slide's a little busy, but it gives you a glimpse into the busy that was happening as we were trying to figure out how to feed our students when our schools closed on Friday, March 13th. We met with representatives from the mayor's office and city leadership to select 30 locations across the city to serve the communities with highest rates of poverty. Starting that next Monday, March 16th, we served a daily breakfast and lunch meal at those 30 locations. The following week, we expanded to 50 locations. The next week, families were coming twice a week to pick up 3 breakfasts and 3 lunches at a time. We quickly learned that our food supply was running short of individually packaged items, and we didn't have the infrastructure we needed to keep refrigerated meals in storage at the locations. We also wanted to limit our staff's exposure to each other and wanted to only have families come once per week to pick up meals. So we pivoted, and you see in the lower left-hand corner, we worked to work with our prepaid provider to develop a box of meals that had 5 breakfasts and 5 lunches with all meal components that met the requirements inside the box, which was frozen. It was a big hit with our parents, and we continued to use this 10 meal box throughout the summer. While all of these changes were made possible because of the waivers provided by the USDA. The waivers allowed us to feed students, not just in our schools in Philadelphia, but any student in Philadelphia under the age of 18. So we are serving students in charter schools and religious schools, as well as pre-K programs and other programs. We did have to purchase extra freezers, rent refrigerated trucks for about 10 of our locations because we were serving such a large number of students out of those locations. And when we realized that school wasn't going to be coming back open, across the top you can see 3 school buses. Those were all of our failed attempts at opening school. While all of that planning was happening, we were also planning behind the scenes to improve our 10-day meal box and to add 2 additional meals. So it's now a total of 7 breakfasts and 7 lunches. We took out the frozen juice and we replaced that with fresh fruit. So now, starting after the fall, really in January, we're now offering a box of meals that have 7 breakfasts, 7 lunches. And in addition to that, we are also able to provide a box of 5 fresh sandwiches through our after-school feeding program. And so our families are really walking away with a good number of meals to set them up for success for the week while they're learning from home. Next slide. So here is a picture of what is contained inside the box. What is laid out here are all of the meals, breakfast and lunch. We do have half gallons of milk that we provide. That's the one item we're able to provide in bulk, so the students don't have to carry all those individual milks home. And in the upper left-hand corner, you can see the supper box, which gives us the fresh sandwiches. That is a refrigerated box, and the rest of the items are frozen. We're going to go to the next slide. And what I wanted to show you in this slide is to really, and also to thank our staff for their resilience as we made these changes throughout this past year. On the right-hand side of your screen, you can see examples of the progression. That's when we started out first packaging the refrigerated meals into bags. And in the lower right-hand corner, that is all broccoli that is being staged so we could then pack it into bags, which would then go into the refrigerator, being held and then handed out to our students the next day. We quickly realized that that was a model that wasn't going to work for us long term. So then in the middle, you can see our boxes. So our staff have really been there with us throughout this whole time. Below there is a refrigerated truck that we use because we didn't have enough refrigeration in some of the schools. And the last picture there does show we are serving these meals outside in the elements. We are not in the buildings. We're at the front of the building. So we really had to adapt. We had to rent tents. We had to do a lot of things to really help us get through this new world that we lived in that was ever evolving and ever changing. So we're grateful to our staff for hanging in there with us and making this possible. And we always come back to focusing on the student. We're doing all of this so we can make sure that our students have the nutrition they need to succeed in their schooling. Thank you.
Well, I don't know about you, but I'm exhausted just listening to what Amy and Jane have had to do over the last 12 months. An incredible effort, obviously, an incredible team effort there. And what really came across here is that flexibility and responsiveness, meeting challenges and adapting to circumstances, not being scared to try something, or to introduce something different if what we're doing is not working. A real credit then to their organisations, and it gives us a real sense of actually what it's involved to deliver that food that we're all so keen on. We're now going to move on to look at research. I'll say a few words about Scotland, but after I've spoken, Erin Hager will say a few words, about the situation in America. Erin is from the Department of Paediatrics, Epidemiology and Public Health at the University of Maryland and is incredibly well networked. I'm not even going to try and list you all the connections that Erin's got in that wider network in nutrition and obesity and policy research. So I'll say a few words about Scotland first, and if we could move on to the first slide. And I think one point to make is that there are many different sectors in Scotland that are interested in research. Jane, I've worked with Jane in Assist FM. Central government are interested in it, the university sector, public health organisations and third sector. Lots of bodies are interested to know what the intelligence is telling us about the effectiveness of school meals in Scotland. And a number of themes are covered, both in terms of tackling poverty, nutrition, and broader public health issues. Now, this is a bit of a purple patch for my unit in terms of March. We've released 3 reports, and I'm not going to pretend we release 3 reports every month, but we have this month. We've released a report on breakfast cart and innovation in East Renfrewshire, something very familiar in America, but less common in the UK and in Scotland, evaluating a pilot project at delivering breakfast food through carts. We have today, this afternoon, at Jane's event with Assist FM, I've released an example of good practice here in Scotland about schools that are doing good things, both in the COVID times and in the years leading up to that, that's leading to a vigorous school meal service that's returning for pupils and for those school communities. And next week, we're going to release a report looking at a State of the Nation report back in the autumn about what catering leads were telling us were some of the challenges that they were facing, very much what Amy and Jane have described to us, and their thoughts about where we were at that time. So research is important in Scotland, I think, is a key point to make. If we could move on, please. But it's not all good news. I mean, Jane had mentioned the scale of school meal provision, but you know, we have to acknowledge that in recent years, there's been a slight drop in the number of children that are presenting for school meals. Not just those that are entitled to free school meals, but also significant amongst those that pay as well. So this fantastic news we've got that we are going to extend provision amongst primary school is set against a trend that is troubling to an extent. And we have to think about what we have to do to make sure that the school meal service is going to work well in the years ahead. So there's a good news in terms of the volume of work that we do. There's lots of good news in terms of good practice that's emerging, but we have to face up to the challenges that the sector faces as well. And we're finding solutions, as Jane outlined in Argyll and Butte. The carts, rather than perhaps breakfast clubs, might be a more effective way of getting breakfast food. What was no longer, or some of the things that were considered to be off limits are now considered to be viable over the last year. So, for example, some schools were not keen on the idea of having split lunch hours, but over the last year they've introduced split lunch hours for different groups of pupil in order to be able to accommodate social distancing, and they're looking perhaps at keeping that going ahead. The wider world, if you like, has came to the school through food. We understand now that it's much more of a community issue than perhaps we did beforehand. And there's also issues, I think, to consider about telling children what will happen to them, or listening to children and giving them voice and allowing them to shape the service. If we could move on. Just some reflections on the nature of research in Scotland, and our research is always going to reflect and say that more has to be done. I think it's interesting to think about those connections between school food and the wider communities. Katie had mentioned it with regard to food supply chains, and Cindy had mentioned that too. And I think that's something for us to consider going forward. Some schools in our good practice guide referred to the way in which children were more motivated about school meals because they understood the environmental impact of making the most of local resources. So I think there's a conversation to be had there in terms of local connections. I think we have to understand the purpose of meals. It's partly tackling poverty, it's partly about nutrition, but I think it's also about care as well. And the way in which that service is delivered is as much a social interaction as it is a nutritional intake. And that context of school meals is very important to many children in terms of that school day. What they get from the dinner lady or dinner man that's serving them up, you know, makes them feel good about themselves. And I don't think we should certainly underestimate that broader impact of what school food is. Children's rights is a key issue as well. This year in Scotland, we are, incorporating into law our commitment to the UN Convention on the Rights of the Child, articulating children's right to let us know what they think in matters that impact upon them. But some of the strategies we use to increase free school meals are telling children what to do. Not allowing S1 and S2, secondary 1 and secondary 2 pupils to leave the school is a strategy that's proved very effective in some schools, but we might argue that it's quite challenging in terms of rights. So I think questions for us to think about there as well. The evidence on whether or not providing food leads to better engagement or better attainment is a difficult issue. It's almost a tenuous link, but it's one I think we have to grapple with and maybe think about what kind of evidence base that we want around about that. The Cash First initiatives that Jane referred to as well is interesting. Rather than provide food, what we did in the pandemic in some cases is take a cash first approach, give a cash equivalent. And that might have implications going forward about how we deliver welfare services more generally. Universalism is back in the agenda. In Scotland, we of course, I mentioned that this week we are extending, or this week it was announced that we will be extending our provision of universal free school food to all children in primary schools. So that's now a direction of travel. It will be interesting whether that's extended to secondary schools in the future, or indeed universalism in terms of what Katie had mentioned earlier, in terms of after school food as well as during the day school food or even before school food. But I think the last thing I would want to say is that we are outward looking too. Our research is not just about researching in Scotland, but it's looking abroad, making connections, researching together. And with that, I think I'm very keen to hear what Erin's got to say about research in the USA.
Great, thank you so much, John. So I am really excited to talk about school nutrition research in the US. So next slide. We heard earlier from Dr. Katie Wilson about the many areas of school nutrition that were addressed under the Healthy Hunger Free Kids Act of 2010. So that's where I'm going to start. So there were updated nutrition standards that went into effect in 2012 for lunch and 2013 for breakfast nationwide. So this was less than 10 years ago. And this represented a significant overhaul of the nutrient composition of food served in schools. And so many research studies have been conducted and published since, including lots of review articles. And overall, they demonstrate that this policy change has led to children consuming more nutritious breakfast and lunch meals in schools. And a recent study also found that for children living in poverty, this policy change was associated with a decrease in obesity. So this is definitely a very promising policy change in the US. Then in 2014, the Smart Snacks program went into effect. And this includes strict nutrition standards for all foods sold in school but outside of the school meal programs. And this was actually piloted in the years prior to the national implementation. And from the pilot studies, the broader launch, we once again saw that with the policy in place, children were consuming more nutritious snacks in schools compared to times when the policy was not in place. And then the third aspect of the Healthy Hunger Free Kids Act I want to mention is the community eligibility provision, which we just heard a bit about in Philadelphia. So this went into effect in 2014, and it allows for schools that serve higher poverty communities to provide free breakfast and lunch without having each child individually submit forms that prove individual eligibility. And so because districts choose whether or not to participate in CEP, it offers a really great opportunity for researchers, because then we can employ some really well-designed studies that compare CEP participating schools versus CEP eligible but not participating schools or districts. And so from this, we've already learned that CEP has led to a reduction in in food insecurity, better attendance, and better academic outcomes. And so we're learning a lot more about CEP as this program continues to roll out, because again, it just started in 2014, but it seems to be a really promising strategy. And so I could easily go on and on about this, but I identified a few remaining gaps, and again, there are many that could be explored. One I want to mention is that much attention has been paid to nutrition standards for the school meal programs. However, the nutrition standards for the summer meal programs still need to be updated. And given that that's what we're operating under now during the pandemic, it's gotten a lot of attention recently. We could also likely use some of those lessons learned from the community eligibility provision to potentially inform opportunities to have universal meals in the US, similar to what's happening in Scotland now. And then similar to what John just said, we always learn from school stakeholders that the more research we do that ties academic outcomes to these nutrition programs, then the more support we're going to get from schools and districts to really expand these programs. And so we really, as nutrition researchers, need to think a lot about incorporating academics into our designs. And then in the US, we are anticipating a new Child Nutrition Reauthorization Act, which will likely include more policies and programs for researchers to evaluate. So more to come on that. And so the next slide, I just want to briefly talk about briefly touch on the research into the school meal response during COVID-19, so over the last year. So I had the honor of co-chairing a national working group on this topic with my colleague, Dr. Fleischhacker, who we'll hear from shortly. And this working group has collectively published over 40 papers just in the past year on this topic. And some of the papers I mentioned in this slide here. And so I want to start by just saying, reiterating that there's been tremendous innovation on the part of those who are actually overseeing the meal service to children during closures, in addition to all the waivers that the USDA issued immediately to help support meal service. And we captured some of those in this paper, and I know others are actively examining this using lots of different mixed methods, approaches, and research. We've also learned that community partnerships and equitable communication strategies have supported meal provision, as noted in this paper here. Having said all that, we also know that we were not able to reach the same number of children during the pandemic that we were able to reach with direct meal service in schools. And this is somewhat not unexpected, but it does lend the question of what about those kids that weren't getting meals. And so we heard that the federal government has issued this policy solution of pandemic EBT, and we are really learning more about that now through different researchers who are studying that as we speak. And I did include a little graphic of a report we did in Maryland that looks a lot at these different aspects of meal service during COVID-19 if you're interested. And then lastly, I want to mention that we know there were major financial impacts to school meal programs, and our federal government did provide funding to support some of those meal programs during COVID-19. But at the end of the day, we really need to understand, was this enough for meal programs to survive and thrive post-COVID? And then again, there are tons of other research questions we could ask, a few listed here. One is, what are the best strategies for feeding children when schools are closed, whether it's anticipated like a break, summer break or a winter break, or unanticipated like a pandemic that we hope we will never experience again. But should we be directly feeding kids boxes of food? Should we be giving money to families to buy food similar to pandemic EBT? Should we give them vouchers to get specific foods, which we do in another program in the US? Or is there another strategy? And I think we really need to understand this. We are interested in what the impact of this meal provision or meal loss has been on food insecurity for children and families, and then what role PEBT has played in alleviating that. And then in addition, I mentioned that the summer meal program, summer feeding has less strict nutrition standards, so we need to learn about the quality of those foods that were served and any role that may have played in weight gain, but then on the flip side, any role that meal losses may have also played in contributing to weight gain. So lots and lots of research questions to unpack there. And then I want to finish by mentioning that we've all been in this together with this pandemic, which has presented in some ways a really nice natural experiment for us to understand all of these things together. And I think that's why we're here today. And so I would hope that people can use an implementation science lens to think about how to best move all of this forward. And so that is all I have.
Many thanks, Erin. And my head's sore from nodding, listening to you about the agenda that you quite rightly suggest that we should be carrying going forward. Lots has been done and lots still to do and lots to reflect on if we are to maximise their impact. So we now move to discussion. I've mentioned to you your discussion host already, Lindsay Graham. She's one of Scotland's Poverty and Inequality Commissioners. She is more effective at matchmaking than any online dating site. She makes things happen, and if she can't make things happen, then she gets people together to make sure that they make things happen. That's the driving force behind us today. I will just say Lindsay won't be able to cover every single question that's been submitted. There's lots for us to talk about, but we assure you we'll pick up your agenda going forward. Without any further ado, over to you, Lindsay.
Well, thank you, John, and thank you very much to all our presenters who've given their time today for this cross-Atlantic knowledge exchange. It is National Nutrition Week across there, and it's National Breakfast Week. And of course, we're on the eve of International School Meals Day. And for those of you that you don't know it, it's also International Bagpipe Day. So I'm joined by Katie and Claire and Jane and Amy, who you've heard from John and from Erin, and thank you all very much for your contributions. So we've got some questions. We don't have a lot of time, but we will answer questions afterwards. So please do submit your questions. If we don't get around to them just now, we will follow up on them. And so we had some prior submitted questions, so I'm going to go those first. And I'm really, really pleased to say that our first question today has come from a young person, which is quite right, I think, given that we're all talking about school meals. It's really good that this has come from a young person. So I want to say thank you to Jacob Kennedy from Scotland. Hello to you, Jacob. And Jacob is a Food Foundation Young Ambassador for Scotland. And so I'm going to put this question to you first, Katie. And he has said, is there any policy that you would take from the other side of the Atlantic back to your nation? So Katie, is there something you could take from Scotland that you think would be useful in the US?
Well, thank you. And thank you, Jacob, for that question. I think that over the decade or more that Lindsay and I have been colleagues, we've shared a lot back and forth from Scotland to the US. But a couple of things that really resonate for me is one, the way Scotland talks about hunger for success. What a neat thought about hungering for success. And we know that nutrition is an important part of academic success. Also, the rights of the child, I think really thinking about the whole child and is it truly a right, a human right to good food. But one that I'd really love to share, and I will definitely be touching base with Claire on this, is that you have nutritionists that are part of your school inspection panel. And I think that we are reviewed once every 3 years. It's completely separate from any other academic inspection of the school. And so I think by doing that and having that nutritionist on that school inspection panel, that it really sends a very clear message that school nutrition is part of a school day and it's critical for good academic success. So I love that idea and I really want to know more about it and see how we can start beginning to think that way in the United States. Thank you.
That's great, thanks. Claire, could I ask you then from a Scotland perspective, is there something that you've seen or read or know about from the US that you think would be useful for us in Scotland?
I mean, it's been fascinating today to hear. I mean, obviously we've had links for a number of years, but it's been great today to sort of look at the examples from, across in the USA. And I think especially as obviously we've all dealt with the pandemic, I think we've got a lot to learn about how we've both dealt with things like that. So learning specifically, I'd like to know more about the EBT cards and how they work. But I think given the fact that it's National Breakfast Week in the USA this week, I think certainly from us in Scotland, as we start to look at opportunities to look how we might do things like that around kind of breakfast provision, I think it'd be really interesting to learn much more about what's happening in the USA, so we can learn how you've developed those programs and look at kind of innovative ways of kind of delivery and practice as well. So we'll certainly be in touch around that to find out how you've delivered on those programs.
Thanks, Claire, that's great. So we've got two questions next from Mary-Ann MacLeod, who's a policy officer, and Amber Roots, I think, who's a PhD candidate. And this is about sustainable local food systems, which is very relevant given the presentations today around COVID as well. And so I'm going to ask you first on this one, Jane. The first one is, how can school meals play a part in strengthening sustainable local food systems? And how are local food supply chains being developed in practice?
That's such an important question, and something I would love to talk about for the next hour, but I know we don't have that, so I'll try and shrink my answer as much as I can. School meals for me are a really critical way of strengthening those local food systems. And I touched on an example in my earlier presentation about the Isle of Bute. It's something that we already hold in high regard. We work very closely with our local suppliers to ensure that they see public sector food as an important part of their business, because schools are at the heart of our communities. So we absolutely should be providing local food, growing in those local communities, supporting local employment and local economic growth, leading to better quality food and drink in school meals. And everyone wins when we put the work in to deliver this. Now, half of the local authorities in Scotland have Soil Association Food for Life Served Here, which is a programme that we have here in the UK, and accreditation that shows our commitment to providing sustainable, fresh, local and good quality food in our school meals. That doesn't mean to say if they don't have it, they don't have the same high standards, but it really is a badge that underpins that. And I think that underlines our commitment to the importance of this. We can always do more, but it's absolutely a firm priority for many of us.
Okay, thanks. Amy, I'm going to come to you now. And there's one here about lots of schools divisions are facing severe budget cuts in the light of COVID. And have you seen school nutrition officers work within their means to provide quality meals necessary to feed children without negating on quality and nutrition? Oh, you're on mute. You're on mute, Amy.
Thank you. That had to happen to someone, right? It's a really good question. And our approach is we are feeding the students first and worrying about our debt second. So we are abiding by the meal pattern and making sure that we can be eligible for reimbursement for our meals. But our meal volume is severely lower than it normally is. And we still have the same fixed cost as our employing our staff. So we have about 900 staff, but we're only at 10 or 15% of our normal meal volume. So when we do the math, that number is a very scary number. So we do know that there is some relief coming in some of the future legislation once the rules are worked out. But we have lots of increased costs. A new walk-in freezer that we needed to purchase is between $8,000 and $10,000 US. So we've had incredible costs. We have written for some grants, and there are grant opportunities out there, but we really need relief from the federal government, which we believe is coming to help us really get through this pandemic, which is something we have never experienced before.
Agreed. I think it's something it's world changing for us all, and mostly for our young people who will be having the burden of this for a long time to come. So thank you for that, Amy. John, I've got one for you now, and also maybe Erin, maybe you can answer this one too. It's, what are the challenges in drawing lessons from one context to the other? So if you're really looking from Scotland to the US and from US to Scotland, John, I'll start with you.
Yeah, and I think it's right that we acknowledge that, because what we don't want to do is to oversimplify. You have to understand the local context. I mean, we talked there just about local food systems, and that means that the ability then to have a local food system, the word local gives us the answer. We have to reflect those local conditions. And of course, our school communities are incredibly different too. Some of our communities have a very high proportion of children from families that are economically insecure. Others are very affluent, but maybe have one or two. A smaller number of children in these communities that are food insecure. So we have to, I think, appreciate context and not look for simple one-size-fits-all solutions. However, and I think it's really important that we do reflect in promise and practice. And I think being alert to the opportunities that are out there, the innovative work that's going on, and then thinking about whether we can adapt that locally should be the priority. But I think it was Rebecca that gave the question, and I completely get a sense that Rebecca's getting at. We don't want to oversimplify this. We have to make informed decisions about what works in our communities.
With the public purse being even thinner now, I think that's really important that we do that. Erin, have you got some thoughts on that one?
Yeah, how's my sound now? Is it better?
Still a wee bit scratchy, but give us a one-liner.
Okay. fine in practice, so sorry. We have a saying in the US, you know, if you've been in one school, you've been in one school. So it happens even at the most local level. You can't translate things from a school to school 100%. And then, of course, as you get bigger and bigger cross countries, it gets even more challenging. However, I think what we're doing today is really important in thinking about policies, and the implementation context then may vary across country. But when we think about kind of the big picture things that we can share and learn from each other, then the local implementation can vary, of course, from site to site.
That's great. Thanks very much. So I'll come back to you, John. Do you see future activities? This one's from James Lyon, who's a deputy head, and he submitted the question: do you see future activities taking place after lockdown to further promote equity that helps support families and schools gain a more equal platform for pupils' future success? And school meals definitely is a part of that.
Yeah, well, it's part of the solution. I think we have to understand that that's what school food is. It's part of a whole school solution to tackle issues of equity, and it's acknowledging that importance. And I know Jim then's a deputy head. There's a leadership issue that's important there as well. There's got to be leadership from the school to acknowledge that. And I think a meeting of minds of the educational leadership and the catering leads within schools to make sure that you know, together school food makes its contribution. And I'm not just a naive optimist as well. I would say that in Scotland, if we think locally, the teachers, the teaching union, have a project called the PACT project, which just now is encouraging and enabling teachers to think about the whole gamut of initiatives that could be used to tackle poverty in their schools. And I think we just have to make sure that food's part of that agenda. So I think there is an acknowledgement that you know, life is unequal. There is an acknowledgement that many of our kids are struggling and their families are finding it school meals. It sends a very strong message out. I'm certainly optimistic for the future, but I'm only optimistic if, you know, the school leadership, putting it back in you, Jim, your responsibility, as well as teachers, step up to the plate and deliver.
I think there's another part for us as well about, other than teachers too, is all the other the members of the school community who can help with this too. And, you know, from a public health point of view, Claire, I think school nurses have a big role as well in that. Maybe when we want to comment about what school nursing could do to support that one.
I mean, I think I would say that the schools have obviously a role in looking at, I mean, across you know, everything that we do. And I think, you know, hats off to what schools have done during the pandemic. You know, everybody in the school has been involved in ensuring that our children maintain both physically and mentally well. And I think that's a key thing here. So I think, you know, within Scotland, we have Curriculum for Excellence, which is our national curriculum. And within that, health and wellbeing is right up at the forefront with literacy and numeracy. I think we've got so many opportunities that I wouldn't want to pinpoint any one specific, you know, person. I think we all have a role working in schools to make sure that we use the ability we have there to enable that to happen, and using lots of opportunities that we have in schools to kind of drive forward, ensuring that children are, you know, healthy and well as well. So.
Great, thank you. So I want to ask all of you a question, and what do you feel, this is a sort of general question that came in, what do you feel will be the most important priority for school meals as we emerge from COVID? And I'll start with you, Katie.
That's a big one. The most important priority. I really think that we have to go internationally to universal free school meals. I think that it just changes so much. It changes the dynamics in the school. It gets rid of stigma. We spend so much time and money administratively figuring out which child classifies for which income level, putting this burden again on the child. Families are burdensome. You know, families are coming out of COVID too. And just because they got their jobs back doesn't mean they're back on their feet. I just think that universal school meals will not only help children across the board, and again, it'll say a really good message that school meals are important for good academic outcomes, but it will also help communities because we buy from local communities. So the larger the participation and uptake, then the more we're going to buy in those local communities. And so I just think we have to think differently about school meals and not have it over here on the side It's not a sidebar. It's an integral part of the school day. And if we get there, then children will win all the way around.
Erin, I'm going to ask you next. You might want to think about on a research slant as well.
I agree with Katie about the universal school meals. And I think we can take a lot of the lessons from how the CEP rollout has happened in the US over the past few years to really advocate for universal meals, because we've learned so much about all the things Katie said about strong evidence about the reduction in stigma and reduction in parental stress. And even the folks who work on the ground and how much easier their job is when they have the reduction in the paperwork and everything. And then, of course, we see academic outcomes and food insecurity reductions. So, so we have research to support it, and we're going to need it more than ever post-COVID. So I'm right there with Katie. So.
Jane, have you got any thoughts on that one?
Absolutely. I'm going to cheat slightly. I've got two sides of the same coin here, Lindsay. The first is that we need to put our children and young people at the heart of our school food planning. That allows us to focus on providing those good, sustainable, freshly cooked school meals that they need as part of that recovery. And the other side of that coin is that we need to keep our staff, their safety and their welfare at the heart of that planning process too. So we can't do one of those things without the other, and we need to keep both of those firmly in the front of our minds as we emerge from this pandemic.
Amy?
I completely agree with what Jane just said. And I'm going to go down a little bit of a different road along the funding line. I feel strongly that we need to close the budget gaps, not through grants or federal grants, but we really need to do it through the increase in the meal reimbursement that we receive for each meal, which will allow us to purchase foods that are in higher quality, more in demand, provide those local foods to our families. If we do it through grants, those grants are sometimes competitive. Sometimes a state is awarded a pot of money that they have to divide over the whole state. So with an equipment grant recently, the headline says millions of dollars is being given, but when you divide it all out, we were only eligible for 2 pieces of equipment, and we have 250 buildings. So I really feel strongly that we need this legislative support and the federal support to really close that funding gap with the school meals.
Okay, thanks. Claire, and then John very quickly, because we're almost out of time here.
I would just echo what everybody said, but I think one of the most important thing for me is to build on the learning. We need to take all this learning that we have had across the pandemic and make sure we use it, share it, use it to the best of our ability. So schools are in the best place to take that forward, and school meals has a huge role in that, and school food and learning about health and well-being. So, they've done such a great job. All our kind of teaching staff, our catering staff, and everybody who works in schools, I think it's really important to build on that and learn. So I think that's what I would say.
Thank you very much. John, last word to you.
All of the above, and maybe a specific issue as well. I think in secondary schools in Scotland, I think breakfast is an issue that really is important, because many children in secondary school don't eat breakfast before they get to the school. So thinking about the ways in which schools maybe can provide breakfast, I think is going to be an increasingly important issue if we want to make sure that nutrition is there for the start of the school day as well as the end of the school day.
Thank you, and thank you all very much for. I could have talked to you for another half hour, definitely, and I think it's something that we'll need to look at for our next event. But so it's my privilege now, from the Poverty and Inequality Commission point of view, to have chaired today's panel. So thank you for that. But also now to introduce Mr. John Swinney, our Deputy First Minister, and who's the Cabinet Secretary for Education and Skills, to say a few words for today.
Meals and food in our schools. The reason is that our Parliament is dealing with items of legislation, and I have to be there to vote on particular changes to the law that's been made here in Scotland. So I'm sorry that I can't join you in person on this occasion, but I do very much welcome this continued conversation between our two countries in working on a collaborative basis to enhance an important issue for the well-being of all of our children. We're celebrating the 9th International School Meals Day, and it's important that in the discussion about school meals we focus on the availability of school meals for all children, but also that those school meals should be of a high nutritious quality and value. And we invest significantly here in Scotland on the principle of having those high quality school meals available so that young people can be nourished well during their education. And if they are nourished well, they will be good learners into the bargain. So we've taken a number of steps to expand the provision for school meals and to make sure that they are of the highest quality into the bargain. And we've done that through increased regulation through the Scottish Parliament, where we've extensively consulted with our wider community to find out exactly what will be the items of food that will contribute to the most nutritious, balanced diet for children and young people in our society. We're seeing important progress in the participation of young people in that process, and we're looking to expand the provision of our school meal element in the course of the years ahead. We intend, should this government be re-elected, to expand the provision to ensure there's free school meals for all primary school pupils, and also to enhance the availability of options around breakfast as well, to make sure that when young people are coming to school, they're able to access nutritious food that can then set them up for the day, and to make sure they've got a really successful day's learning supported by a nutritious start to the day. Now, these are all ideas that we've looked at through the process of extensive discussion around the issue of school nutrition, and many of those challenges have come into sharp focus during the course of the COVID pandemic, because what we've had to do there when our schools have been closed is make sure that young people who really need to have access to free school meals are able to get that financial support at home. And many of our local authorities have provided financial assistance directly to individual families during the pandemic to provide that essential support for families who face these challenges. So as we look at the progress we're making on school food and on nutrition, it's important to link this discussion with the poverty that we tackle within our society and the well-being of children and young people in Scotland. And we gain a great deal from the dialogue and the conversation we have with the United States on these important questions. So thank you for your participation in this seminar. We very much look forward to hearing the outcomes of the discussions and to continue to learn more from each other as we continue to enhance the availability of school meals and school food for the children and young people of our two countries.
Yeah, I promise you, we didn't give them a script, but a lot of what we've just heard there is a lot of what we've said over the course of the afternoon. We talked about listening to the voice of the child. We talked about the importance of nutrition. We talked about the whole school food, the whole school day in food, breakfast as well as lunch. We're very grateful for our Deputy First Minister for finding the time, and very reassuring for us for what we've just talked about for the last almost an hour and a half is certainly on his agenda and how our Deputy First Minister views the issue. The last thing that I have to do before we finish is to hand you over to our end speaker, just to thank everybody. Sheila Flyshaker will be a well-known figure to those from America, leading figure within NOPRIN, academic in Georgetown University and recent appointee to the Department of Agriculture in America as well. Sheila's been centrally involved in organising this event, so it's my great pleasure to hand over to Sheila to say a few thanks and to round off the event. Thank you.
Thank you, John. Many of you who know me know I love to use the phrase teamwork makes the dream work. And that was definitely what you saw today. The panelists were outstanding. In our virtual stand-up word, please give them great thanks for sharing all their time and thought today and just really being actively engaged throughout the months planning this event and hopefully this series and future work of knowledge exchange. Without question, we're very thankful for the frontline workers making school meals happen every day in our two countries. There is this elaborate discussion about how they've worked hard to make sure kids have healthy meals and particularly keep themselves, their families, and their kids safe during this time of pandemic. This joint webinar would not be possible without the invaluable contribution of many behind the scenes contributors who are not event facing. That includes our fabulous HER NOPRIN COVID fellow, Caroline Dunn, also one of our sub-leads in that COVID group, Gabby McLaughlin. From the UK, for Scotland, I want to highlight Clara Perry, Flora Douglas, and Carrie McKenzie, and also our fabulous events team who just made this transition of many speakers happen. That's Julie Duncan and Liza O'Benley. As noted earlier, all your wonderful chat box questions, very thoughtful and insightful. We will work to answer them, and then we will follow up to all registered participants with responses to all your questions. We will update our background materials, including, as John noted, 2 recent updates here in Scotland and the US on the policy side. We encourage you to use those materials, use them with your students and with your colleagues for advocacy. We will also have the recording available, and we encourage you to disseminate widely that link. I know just from my inbox, many people weren't able to join today, but we're looking forward to this recording. We look forward to building out this joint US-Scotland series, maybe even to other countries as well. And we welcome your suggestions on what topic to dive deeper into and what webinars to offer you, really to help lift up the work you're doing. Please complete the short evaluation link available in the chat box, and we will also send this to you via email. We really do value your feedback. And last but not least, we want to thank you for all your time and interest in promoting school meals across the world, and really just want to encourage you to have an outstanding International School Meals Day tomorrow. Thank you.